So now let's move so much bone scanning over the last 14 years. We like to correlate between the two. And so we've looked at the numbers for 185 cases recently, and the injury trends by breed. Warm bloods. We're looking at 64% of the ones in our population in Southern California have had a collateral ligament injury, as opposed to quarter horses, where about the same percentage had obvious navicular disease. Now that's new information as far as we're concerned, because all horses have feet, and all feet have navicular bones, and all horses go lame in their feet, and so therefore they all get navicular syndrome, whatever that has meant for the last 20 years, okay? Well, we now can tell the difference. And what I would tell you is I think that we're going to find, this is speculation, but I think we're going to find an anatomical or some kind of a difference between warm bloods and quarter horses as to why the quarter horses severely injure their tendons and navicular bones, and the warm bloods tend to do soft tissue injuries. But for you in this room, unless you're riding a quarter horse doing dressage, it's great news, because a lot of the lame warm bloods are treatable. And that's so exciting for me. After 20 years of doing lameness, I can now stand up there. And some of these horses have been lame for 6 months or a year before they finally come in for the MRI and the bone scan. And if it's a strain to the ligament, they still can get better. Okay, let me just tell you one more thing about the collateral ligament issues, is that it's common in that caseload, and for years I've been looking for ways to give information back to the veterinarians that don't have MRI or bone scan, and I failed miserably with a lot of these problems, especially these enthesiopathies, because you can't even press on that spot. So I've seen the bone scan, I see that hot spot, and I block it out, and I know that's the horse's problem, but I press as hard as I can, and the horse tells me nothing. Part of it is because they're warm blood and they have that thick skin and the thick structures, but part of it is because it's a pulling that the horse feels as they're trotting or cantering that I can't create with the physical examination. But finally, we've got something with this collateral ligament stuff. So this happens to be a Show Arabian on this side, but he's got a problem with the soft tissues of the fetlock joint. And so as you can see at the beginning of this, he's actually going to have a problem. Should be playing there. He has a problem just with palpation, but then watch the way I flex this. So I put my hand on the carpus now and flex up like that, and that's obviously painful to him. If we find that to be the problem and that to be positive, that tends to be the soft tissues on the palmar aspect of the fetlock and or the fetlock joint itself. But if that first way on the bay horse is negative, and then I turn around and flex this way, and watch this, head goes up, hind limb goes back, ouch, ouch, okay? She's not positive the first way, but she's positive the second way. That, in our retrospective work of looking back through our last 4 years of cases, has been very, very suggestive of a collateral ligament problem in the foot. So, not positive positive the first way, palmar soft tissues and or fetlock. Not positive the first way, positive the second way, coffin joint, usually collateral ligaments. If they're positive this way, they'll be very upset with you this way. Okay, so that's for sure. But if they're negative this way and they're positive like that. Now the other interesting thing about this that's really made my job easier is all my clients always want to know, when can I go back to work? And what we found on that is when that flexion is no longer positive. So here she is after her treatment, and she could care less. She doesn't look like the same horse because she lets down pretty badly too, but she could care less. Okay? And that was 2005. That's why I'm thinner and my hair's blacker there on this one. And she was having issues. She's a show jumper, not dressage, so bear with me. But she was having issues, and 1 out of 5 lame, and we were trying to get the last World Cup qualifier in. And she went 3 out of 5 lame before the Del Mar show, and so we had to scratch her, and that was when she was up here that positive. Okay, we did the treatments that I'm going to talk about here, and then a couple months later, she came back this level, and then she came back to this level. And she is so good that she was West Coast Show Jumper of the Year last year for 2006. She was at the World Cup in Las Vegas in April. And she doesn't mind me talking about it because this horse was 3 out of 5 lame, very flexion positive, and not getting better. And now she's been the poster child because she is still going strong in 2007. So that was 2005. 2006 she competed, show jumper of the year, and she's been sound ever since. So that's been our experience with that. So let me just tell you a few kind of conclusions. With our current clinical regime on that, for the quarter horses, we recommend that the quarter horses go straight into MRI because they so often do have an injury that's very obvious. With the warm bloods, we highly recommend a bone scan first and then an MRI. And I don't know if there's any representatives from the insurance company here, but they have been... There is? Oh, no. They've been very supportive of that. And the reason is because they realize that what we're trying to do is get a definitive diagnosis to focus the treatment, and no pun intended, because some of it is Shockwave. When you know where the problem is with the bone scan, and then you find out how bad the injury is with the MRI, then we can tailor the treatment. So, other breeds I don't know enough about. MRI, the accurate diagnosis leads to more appropriate treatment, and the insurance companies like that. So let me talk a few minutes about treatment. Shockwave. A very good veterinarian that graduated a year behind me in school who practices in the Northwest had a question at our last lameness meeting in August, was saying, does Shockwave really work? Well, here's what I can tell you about my opinion about Shockwave. Number one, for the MDs in the room, there's a brand new book that's just come out in the last year on Shockwave. A lot of it's been research and work that's been done. So there is some research now, but there isn't a lot. But most importantly to me is that the research has been done in people where people can identify whether it hurts or not. They're saying it works. And the most classic, if you want to know how Shockwave, I'm sure everybody knows about Shockwave focused ultrasound beams. The interesting part about the book that they've told me about, actually the authors, I met the authors at a human meeting in San Diego last spring, is that it started for plantar fasciitis, which is the heel spurs, okay? And if does anyone have those? I don't. Okay, they're painful, I hear, very painful. But when they take a lateral x-ray of the foot, in a lot of cases they saw what they thought was a big spur coming off of the heel. Shockwave was initially used to break up bladder stones, and so they thought that the orthopods are thinking, okay, this big huge spur is digging into the soft tissues in the foot, and that's why every time you take a step it kills, okay? So they said, well, we break up these stones, maybe we can use this thing and break up that spur. So they did a trial then trying to break up the spur in people's foot, and what they found is it was some high number, 80% let's say, improved in their clinical signs or became completely sound or pain-free. Not one of them changed on radiographs. The radiographs stayed the same. And they thought, okay, that doesn't make sense. What's happening? And what they realized is it was an enthesiopathy. They were treating a soft tissue insertion onto the calcaneus, the heel bone, and that spur is not a spur. It's now another big word, enthesiophyte. It's a bone remodeling at the insertion of the soft tissue. And that's why Shockwave works. Now, if anyone, you haven't tried that or whatever, I heard it's incredibly painful to get that process. So I've heard some of them will actually anesthetize the people. It's that bad. But for people, horses don't seem to mind. We've never had a horse have a problem with that. So what about Shockwave? Do I think it works? In one word, absolutely. In 4 or 5 more words, but it depends on what you're treating. Number one, what the problem is you're treating, and more importantly to me, is if the problem's here and you shockwave here, it's not going to work. If the problem's here, you got a shockwave there, and so how do we know? Well, that's where bone scan has helped us dramatically. Is bone scanning allows us to see specifically where the spot is. And to that hawk I just showed you, she called me yesterday and said, horse is 100%. I'm amazed. 2 shockwave treatments, and it was a pretty lame horse. But that's what Shockwave is for, is soft tissue where it inserts onto bone specifically. It has revolutionized this collateral ligament, so there's an x-ray showing how the angle that we shockwave down into the collateral ligaments. It's a fabulous treatment for those, anywhere in the body, but specifically these coffin joint collateral ligaments. What I can tell you is that if you go online and read about collateral ligaments of the horse's foot, I don't know if any of our papers are going to start showing up there, but you might see one from Europe where they had an 18% return to function with horses that had a collateral ligament of the coffin joint. Well, I know the researcher, Dr. Dyson, and we were on the program together at the World Cup 2 years ago in Amsterdam, and she was telling me that what they had done is they had rested the horses in their population for the most part. They hadn't done any other treatment. Well, in ligament problems, that makes sense to rest. It didn't work. With these collateral ligaments of the coffin joint and some of the other joints, rest doesn't make a difference. The horse gets better, possibly, but 2 weeks back into work and he's just as lame as he was. I don't care if you gave him 6 months or a year. Some of them come back just as lame as they were. This case, and it helps with the collateral ligaments which are around the joint, not necessarily even in, but around. Branch desmitis of the fetlock, a lot of things that are incredibly exciting for us. So again, if you say, well, I've tried IREP and it didn't work, it might depend on what you were treating. Our experience with the soft tissue injuries around joints has been really, really promising. With arthritis, it has not been so promising.